Okay, today we are going to discuss about hyperlipidemia. Hyperlipidemia, it is simply known as elevated level of fat or fat particles, known as lipids. Now, lipids. What is lipids? If it is elevated level of lipid in the blood vessel, what it will cause, it will adhere to the artery of the blood vessel and it will form the atherosclerotic, or it will restrict the blood flow and it will lead to the stroke or heart attack. Now, three types of lipids are there which we know: cholesterol, triglycerides, and phospholipids. Now, uh, in the sense it is good for the body. In the sense, if it is high, it is bad for the body. If it is low, it will be good for the body. Like cholesterol, it will helps to it will helps in the synthesis and production of the steroid hormones and integrity of the cell membranes. And comes to triglycerides, what it will do now, it will store the lipids throughout the body and it will give the energy to the body. To come to phospholipid will act as an emulsifier. Now, what will happening? This all the lipids are insoluble in the this all these lipid are insoluble in the blood. For make it distribute throughout the body, it is required protein capsule called lipoprotein. Now, the lipoprotein is what to say? It is categorized in the two phase: hydrophobic and hydrophilic. In the outer cell, it is made up of hydrophobic, that is triglycerides and cholesterol. In the inner cell, no, inner cell is hydrophobic and outer cell is hydrophilic cell. Hydrophilic, it is made up of apoproteins and phospholipids and apoproteins. These apolipoproteins are the important enzyme. It is important enzymes in the lipoprotein metabolism, and it will serve as ligand for lipoprotein receptors. It will attach and it will lead to the decrease of the cholesterol. Now, depending on the lipids ligands and depending on their density, these are classified into four categories: one, cyclomacrons, low density lipoprotein; very low density lipoprotein; and high density lipoproteins. Now we'll come to cyclomacrons. What is this cyclomacrons is? Cyclomacrons is produced from gut, from the dietary source. Now what will happen? These are produced from the gut, and VLDL are produced from the liver. What will happen? Then after the production of these two, it will go to a blood stream. In the blood stream, there will be the presence of lipoprotein lipase enzyme. What will happen? It will release the free fatty acid. Free fatty acid. This free fatty acid, which is taken by tissue in the form of triglycerides, and it will in the form of triglycerides, this free fatty acid will be taken. Then automatically it will decrease the level of VLDL, and this VLDL, if it is decreased, then what will happen? No, it is triglycerides decrease VLDL, it will form into LDL form. LDL. Then what will happen in LDL? LDL will get converted from VLDL, it will get converted into LDL. Now here LDL, what will do? LDL is also one of the most important factor in the body for cellular synthesis and for integrity of the cell membrane. Then what will happen? This LDL will get transferred to the liver directly. Why? Because LDL will produce the bile acid. It will helps in the production of the bile acid, and bile acid is important for the absorption and digestion of the lipids. Now what will happen? This maximum amount of like 50% of the cholesterol will get decreased here, VLDL, and the remaining amount will be in the LDL amount, in a huge amount, like 50% or something like that. It will transfer to the liver, and liver will do their work by digestion, and HDL, the remaining cholesterol, some amount of proteins, the proteins will be called as HDL. It will be remaining in the HDL form. Now this over means how it will be how it will go to the liver, how it will be digestion, and all those things, lipid. Now we'll come to, like, if it is high level of LDL, then what will happen? It will accumulate to the blood vessel, enter the artery, and it will lead to the atherosclerotic, and it will block the artery, and it will lead to the complication, cardiovascular complication, or stroke and heart attack. Now, to reduce this all, some drugs are there, classification of drugs. First line drugs, it is HMG co-reductase. It is the first line, it is the first choice also for every physician. What will happen in HMG co-reductase? Here it will deactivate HMG co-reductase enzyme. Why? It HMG CoA convert into mevalonic acid, and mevalonic acid convert into cholesterol. It is a precursor of cholesterol, is the precursor of lipids. Now what will happen? It will inhibit the HMG co-reductase enzyme only, and this formation will not happen. Then automatically it will reduce the cholesterol synthesis. Now what will happen? Now the liver will come to sense that the cholesterol is decreasing. Now it will accelerate the more receptor, LDL receptor here. It will accelerate the LDL receptor. In LDL receptor, what will do? The statins will bind and internalize this also, this LDL receptor also. Then after that, what will happen? Automatically, after the synthesis decreasing of the LDL, the VLDL also will get decreased. After that, this VLDL will stop. Then this HDL, it is not fully explained, but from different mechanism, it will increase the HDL in the blood. Now, example, lovastatin, simvastatin, atorvastatin, and rosuvastatin. Now, bile acid sequestrant. What will happen here? This bile acid, it is produced in the liver and stored in the gallbladder. What will happen? This production in the liver and excreted in the gallbladder, and it will excrete in the small intestine. Then what will happen? It will bile acid, what will do? It will facilitate for absorption and excretion. There will be the basically it will produce some ions. These ions, what will happen? And here it will be negatively charged ion. What will happen? Bile acid will attach to the negatively charged ion, and it will make a complex which will be insoluble in the lipids. And when it will be insoluble, what will happen? It will not reabsorb in the blood again. Then it will get excreted through the feces. The main mechanism of bile acid sequestrant is to inhibit the reabsorption in the blood. Now we come to nicotinic acid. What is nicotinic acid? Means only one drug is here, niacin. What will happen? Niacin will inhibit the product. It will attach to the enzyme called hormone sensitive lipase. Hormone sensitive lipase, if it is attached, what it will do? It will break down the cholesterol and lead to the triglycerides, and triglycerides will release the free fatty acid and in the adipose tissue, and this free fatty acid will be taken by liver, and this free fatty acid will be taken by liver, and this liver free fatty acid, they will make the triglycerides, and this triglyceride, this hormone sensitive lipase, all those mechanisms, what will happen? Niacin will attach to the free fatty acid, and it will attach here, and it will lead to decrease the free fatty acid level, and with the help of this, it will lead to decrease the VLDL, and with VLDL, it will reduce the LDL also, and it will decrease the HDL level. Now come to cholesterol absorption inhibitor. Okay, cholesterol absorption inhibitor, what it will do? No, it will be like in the cell membrane, there will be the presence of cholesterol, and there will be presence of this enzyme called NPC1L1 protein. NPC1 L1 enzyme. What it will do? It will make a, if it is drug is not there, if drug is not there, what will happen? This will be moving to the cell membrane, and what will happen here? They will make a complex that is called Catherine complex with cholesterol and NPC1L1. And what will happen? If it will make the complex, it will release the NPCL, it will NPC1L1, and it will go again to the cell membrane, and this cholesterol will release, and it will go to the liver, and it will increase the cholesterol level. What it will do in here, cholesterol absorption inhibitor, if you are giving drug, it will inhibit here only, it will not allow this process to go on, then it will lead to the cholesterol inhibition, and the drug is ZMB 10 mg. Now come to the fibrates. Actually it is primarily acting on the what is the enzyme called? PPAR alpha. It will act on the PPAR alpha. It will and it is found in the active cell like liver. One second, I'll say about this fibrates. Fibrates work primarily by activating the nuclear transcription called PPR alpha. What will happen now? It is found in the liver and adipose tissue. This the fibrates will bind to the PR alpha, and it will induce activation or inhibition of the certain enzyme, and with that enzyme, this coats the protein in the protein in the vessel, and will inhibit the lipid metabolism. These fibrates. Now we'll come to the side effect. This thing HMG choreoreductase, it is metabolized in the liver. The main side effect of HMG choreoreductase is it will cause liver toxicity, it will cause myopathy, and it in the some extent it will lead to the rhabdomyolysis. And if you are giving statin, it will lead to the increased level of liver enzyme. You have to check for lipid profile. And the drug are lovastatin 10 to 80 mg, and simvastatin, atorvastatin, rosuvastatin. Now here what is happening, this in our hospital atorvastatin and rosuvastatin are mostly prescribed, and for renal only rosuvastatin is required for renal adjustment, not other drugs. And statins are in our hospitals, it is given as a single atorvastatin, or it will combined with antiplatelet, dual antiplatelet, or single antiplatelet, and they'll be giving. Okay, the niacin, the side effect is it will cause flushing, because of it will induce the prostaglandin release, which result in cutaneous vasodilation, and it will compete with the uric acid for the excretion by the kidney, which can increase the hyperuricemia and GOT. And lastly, it will niacin will also cause liver toxicity. And the side effect of fibrates is GI disturbance, myopathy, like statins myopathy, and rhabdomyolysis. But it is not proved, but it is in some patient, in the rare, it is in rare case it is seen. And for bile acid sequestrant, the side effect is GI tract. GI tract side effect will like bloating, nausea, diarrhea, constipation, like that side effect will be there, and it will decrease the fat soluble vitamin. It will reduce the absorption of the fat soluble vitamins. And this this thing, cholesterol absorption inhibitor, it have limited side effect, and the patient is not tolerated with the HMG co-reductase, then they will go for cholesterol absorption inhibitor, the alternative therapy for statins, which are intolerant to the statins.